surgery. Any one of them, or sometimes all of them, may have to be used together in a particular patient depending on the severity and the state of the eye. Now the treatment is neither curative nor does it reverse the damage done, which is the saddest part. Unlike cataract, when we remove the cataract implant, the lens vision is back to normal again. Here, the damage once done is done, it cannot be reversed. Only the further damage, future damage, can be prevented by the treatment. So it is very, very important to pick it up as early as possible, when there is no damage or hardly any damage done, and monitor it regularly. It's a disease like having diabetes or BP, where in diabetes you have to control the blood sugar, in hypertension you have to control the blood pressure, here you have to control the eye pressure. And you have to keep putting the medicine, or you have to keep taking the treatment, you have to keep coming for follow-up on an ongoing basis. The drugs are usually in the form of eye drops. One may have to use 1, 2, maybe 3 or 4 drops also. But if a lot of drops are required, then we think of going to some other step. No, some patients may require laser also. Not all patients require laser. And some patients, advanced cases, require surgery also. Surgery in the form of what is called a trabeculectomy or filtration surgery. It may be simple filtration surgery, or we may have to use some special devices or implants to do the surgery. But whether surgical, medical, or laser treatment, the bottom line is that the damage once done is not reversed. So it's very important to diagnose early and to treat it on an ongoing, regular basis. Who are the people at risk? So if we have to say, okay, fine, that it has been picked up early, then we should know that who are the people at risk, and those are the people who should actually be particularly careful and get themselves examined regularly. It usually affects people above the age of 40. I'm sorry for the spelling mistake here. It's very uncommonly seen in people less than 40 years of age. However, it can happen even in young children also. But people at older than 40 years of age, they are at risk. Where there is a family history of glaucoma. So if your parents, if your siblings, if your first or second degree relations have had significant glaucoma, then you're at a very, very high risk. So you should go for your regular eye examination. So after the age of 40, everybody should get the eyes examination done, maybe once in a year. People who have got a high glasses power, a high myopia, or even a high hypermetropia, a high plus number or high minus number. If you've been using glasses for a long time, you're at a higher risk for getting glaucoma. High myopes can get what is called open-angle glaucoma. High hypermetropes can get closed-angle glaucoma. If you have diabetes, you're at a higher risk of getting glaucoma. People who got thyroid disorders, hypothyroidism are at risk of glaucoma. People who have to use steroid drugs in the form of not just the eye drops but also orally. Say if somebody's got asthma, long-standing asthma, for which they have to use steroid. Somebody's got connective tissue disorders, allergies, and they're using steroid for that. When they're using steroid in the form of tablets, inhalers, sprays, creams, ointments, eye drops, steroid use anywhere in the body in any form puts you at a high risk for getting glaucoma. So fortunately, a good fraction of people are not responsive to steroids, but 35% of people, their body responds to steroid by increasing the eye pressure. And 35% is a big amount. So whenever one has to use steroid for any duration longer than a week's time, one should get eye examination done. So regular eye examination is again a must. So being potentially a vision-threatening disease, potentially blinding disease, the take-home message for glaucoma is that the regular eye examination is a must after the age of 40. And anybody who has got any of the risk factor should then get their eyes examined regularly. Any questions you have on glaucoma, we'll be very happy to answer. Or any question you have on any subject related to the eye.
Average
Cost for eye surgery.
Yeah.
Say if you have to go for the MICS, with the unifocal lens implantation, it is typically in the range of about 35,000 to 40,000 or so. If you have to go for MICS with multifocal, one eye, sir. If you have to go for say multifocal lens implantation, the cost kind of becomes double because the lens is more expensive. For glaucoma surgery, again, the cost would be approximately 35,000 to 40,000 only. But glaucoma surgery is required very, very rarely. Mostly glaucoma is managed by the drugs, by the eye drops, but yes, the regular tests are to be required. So every 3 months you have to get your pressure checked. Every year you have to get your other specialized tests done. The costs, though they're high, but they're much less compared to any other specialty. So if you go for any cardiac surgery, what we talk in terms of thousands, they talk in terms of lakhs, you know. So costs are much less, and again, the cost being actually less being that eye surgery has been supported very heavily by the government for a long, long time, and being done at a very, very high scale, large scale, and very, very important part of the body. The costs have come down dramatically. The laser costs right now are high. So if you do the laser, the femto laser surgery, it will be in the tune of 1 lakh now. But hopefully, as more lasers come into the market and cheaper lasers come into the market, the cost of that will go down also. But that may happen in about 10 years' time.
But you're saying 30,000 for one eye?
35 to 40,000 for one eye with the use of unifocal lens by MICS. By
laser?
No, the laser will cost you 1 lakh. The femto laser surgery will cost you 1 lakh with the same kind of a lens. Per eye.
Per eye. Yeah. That means 2 lakhs.
It means 2 lakhs.
Surgery will be 30,000.
The MICS, the other surgery, will be 35 to 40,000.
So why there is such a big difference?
The equipment cost.
Equipment cost.
The machine costs 5 crores. The laser machine is 5 crores. And so there's a cost of material involved there, the cost of the machine involved there, the manpower involved there. You know, so all those things, they add up to the cost.
So what is the right way to go? I should go for a laser or surgery?
So the question is
One eye at a time.
whether to
One.
buy a Maruti 800 or a Maruti Alto or to buy a Mercedes.
Mercedes like any Maruti 800 is much convenient than a Mercedes.
Yes. No, there are smaller Mercedes also, A-class Mercedes also there. You know. So sometimes the choice is that. You know. And actually, this is a wrong comparison. The choice is more of, you know, say buying a mid-segment safe car versus a luxury premium car. You know. Naturally, which car which is more premium has got some advantages also. It's more comfortable, it is safer also. But the difference is not too big.
A person like me wants to pay out of his pocket. What should I do? What will you advise me?
So it's a very, very personal thing. You know, whether Titan watch or a Rolex watch.
So I can't take a risk with my eyes, that's for sure.
Yeah.
Under any circumstances.
Yeah.
What should I do? Surgical is as safe as laser.
Both are safe surgeries, but the degree of safety is slightly better in laser. Slightly. It's not, as I said, not Zameen Asman ka antar. It is 19, 20, 18, 20 ka antar.
How do I select a doctor?
How do you decide the doctor?
80 doctor to 45 doctor.
Toss the coin, sir.
No, that's not.
That is the answer.
That's not the answer.
So, okay, no, this is a very, very important question, very serious.
I'll tell you one.
Listen,
I
listen.
went to eye hospital.
Yeah.
They said if you go to this doctor, you will have to pay X.
Yeah.
If you go with this doctor, you have to pay Y. If you go with this doctor, you have to pay this much.
Yeah.
How do I find out which is the most expensive doctor, maybe the worst human?
So that's why we at Max follow more rational style of working. Doctor A, B, C, D, X, Y, Z, we all cost the same. So there's no difference in the doctor. And
How does he decide?
So the question, the most important question is how to choose a doctor.
Yeah.
And I'll tell you, this is the most difficult question even for a doctor. You have to do your homework well, your research well. And the most important way is that you should talk to people, your friends and family who experienced the doctor, and take their opinion. And do your research on the net about the doctor, about the place also. And then make a short list. And then maybe go meet a couple of doctors. There's no harm in consulting 2 doctors. So it will be a second opinion also. Plus you'll be, you'll get opinion about your eyes and you'll form your opinion about the doctor as well. So maybe go to 2 doctors but not go to more than 2 doctors.
It's like marriage, you don't know what you're getting.
You're right.
No, it's very easy, much easier to divorce a doctor than to divorce your wife. No? And you don't have to pay any alimony also. So, no, but this is a very, very important question. And I think that going and meeting maybe 2 doctors is not a bad idea. And when you meet a doctor, if you use your common sense, see, you're all very, very senior people. You've lived your life, you've seen this world, you've seen people, right? I think within no time you can make a judgment about which person is genuine and which is not genuine. So I would say that you should look at the genuinity of the person, rated as the first criteria, the most important criteria. Why? Because technology these days is more or less the same. Skill level is more or less similar. And a slight variation in skill level will not affect the results at all. All the doctors they would get to hear about are usually good doctors, good surgeons, have got access to good facilities also. Good infrastructure, everything is fine. But it is these days, in present times, it is the intent of the person. It is the integrity of the person where there is a lot of variation. Not just in doctors, but across the society. So the critical variable here is the integrity of the person, be it doctors, be it lawyers, be it politics, be it people walking on the road also, people driving on the road. There's somebody who stops the car at red light, the other would just go jump it also. So so that is what you have to see. So it is not the car which is being driven which is important. It's the person who is driving the car which is important. So will this person slow down before the red light and stop when the light will go red or not? Or is this the guy who will just see that there's no policeman standing and will jump the car? So this you have to distinguish between the doctors also. So which doctor will jump the red light, which doctor will stop at the red light? You have to decide that. And once you decide
How
that,
can you get so much knowledge about a particular doctor who you may meet under professional circumstances?
sir, I said that you people are all senior, you've seen the life, you can make judgment about a person in maybe very short time. But plus,
We've all made our mistakes in very responsible.
And they're irreversible.
that's why I said, you look at the human side of the doctor more than the commercial side. Right. The most expensive doctor, as you said, may not be the best doctor.
Yeah,
So you have to go by that. And a starting point for your research would be, opinion of your family and friends who had their first-hand experience with the. Second point would be go onto the net and research about them. And then third is go there and make
Plus,
a
I think you
judgment.
should, like,
Next, all the netting are beautiful and everything.
yes, I think you should read about the disease. You should be ready with your question. Then you will be able to
Let's
judge
say
the person.
You have whatever level of knowledge of the disease.
Little
It's
bit.
now a question of who's going to solve that
Solve the
disease. So that you can't tell from.
Not a simple,
your
straightforward.
It's actually very difficult.
Very
question.
difficult, yeah.
Decision.
Yeah,
Yeah.
definitely.
In this case, big eyes and so forth.
Excuse me, sir.
he'll charge this much, he'll charge this much, he'll charge this much.
I don't think you should go by the chart. That's all.
Charge is not.
Sir, I am a thyroid patient. I just want to know if I keep my thyroid level in control, I am taking regular medicine, even then I am at risk.
for
See,
glaucoma.
the risk of glaucoma does not depend on the thyroid level.
Okay.
They both have common predispositions. So, say the genetic factors which can cause thyroid disease are also known to be associated with glaucoma. So the risk factor is high. So it's not that the thyroid level is causing glaucoma. It is the common. They have a common. They come from the same family.
Okay.
So that's how it is. So they have a common genetic predisposition to these two diseases. So you should get yourself examined regularly.
Yeah, I go
and if it is
for
ruled out, then you can be safe. You don't have to worry about the thyroid level being affected the eye pressure. Is there anything else from add to this?
नहीं बस वही है because ये incidences मतलब आपका जैसे normal population में if there are 100 disease free normal people उसमें glaucoma incidences 3 to 4% prevalence मतलब 100 में से 4 लोगों को glaucoma हो सकता है. अगर हम यही 100 normal people we make them thyroid people, the incidence will be probably 6 to 8%. Similarly, in a diabetic population of 100 people, the glaucoma chances may again be 6 to 7%. So the chances increase only because they are genetically linked. As he rightly said, it's not related to your thyroid pressures. So just comfortably once a year go for your routine eye pressure check and that's fine.
Okay. Thank you.
Any other questions?
Sorry, in diabetes, it's related to the control of diabetes. So if your control of diabetes is not good, then it leads to deposition of a substance called mucopolysaccharides. So that diabetes control is important for prevention of glaucoma. Unlike in thyroid. No, dry eyes does not lead to glaucoma. The steroid intake, local or oral, does lead to glaucoma.
Or the treatment of glaucoma tends lead to dry eye also.
Treatment of glaucoma can
cause
lead to
dry eye. The eye drops used.
That's a separate.
This question. Okay, I'll just tell you.
Yeah, I was also trying to ask the similar thing. I had glaucoma, symptoms. So I've been getting my tests, field tests and all that every 6 months or so. So that's no problem right now. But the dryness of eye is a big issue. Because these days, whether I see the projector or I see the TV screen or the laptop, it creates a lot of, although all those precautions that you close your eyes, rest your eyes, wash your eyes, all those things we do, but that has been a bigger problem. And the natural tears and all those medicines does help a little bit, but it's not being a solution. And perhaps the eye layer is very thin. It is generally reddish, and it creates a lot of uncomfort, and the muscles also pain. So for that, they said that there's a duct which goes from eyes to, I think, throat, which is choked. So I was advised that you check up. I mean, maybe it will need some surgery. But then the plastic surgeon who does it, he said, no, it's okay right now. But the problem, which I would like to come to you sometime, is the dryness of eyes and the tears not going out. Supposing I put medicine in eyes, it should get me taste in the throat. It doesn't come sometimes. So that creates a lot of uncomfort. In spite of the exercise and all that, it's not a comfort.
The two questions are kind of overlapping, the dryness and this. No, I like to group into two different forms. There is one thing called dryness, dry eyes, and there is also, you could say, a general discomfort of the eye. So what you're referring to is more to general discomfort, and what you're talking about is the more dryness in the eye. Often we mistake one for the other. With age, the eyes do get a little more dry, more so in females than in males. And things like thyroid and all cause more dryness. That is normally bound to happen with age. Some people get dryness in itself, as a disease itself. That the eyes, the tear secretion in the eye is much less, the tear film is disturbed. No. Those are the patients who would need a constant use of artificial tears or tear supplements. But many a times, what we call dryness is actually an eye strain caused by our lifestyle. So spending a lot of time reading or looking at any screen, be it phone screen, laptop, TV and all, does put a lot of strain on the muscles of the eye, does cause the eyes go temporarily dry. Because when we're staring at a screen, our blinking frequency goes down, the tear evaporation increases, our muscles are constantly strained. We find it's a very simple thing, but why should cause a problem? It does. It's like if I ask you to stand like this for a minute or half a minute, it's a very simple thing. We say now maintain this posture for next 2 hours. What will happen? After half an hour, it will be like that. We do this to our eyes day in, day out. When we look at any screen, be it TV screen, watching a serial in front of the TV, or reading, or looking at the computers, our muscles are constantly gazing at that point of time. And we get lost. We get lost in that, eyes in that position, blinking goes down, tear evaporation happens, dryness happens, muscle gets strained tired. So the solution for this is that frequent breaks are required. So every 10-15 minutes, sit back and close your eyes for a minute. Every hour or so, take a short break, then come back and work again. Try to blink more frequently, consciously also. Strengthen your muscles by doing regular eye exercise. Use of lubricant eye drops in this situation may help a little bit, but should be kept to a minimum required. So once you know that it is the muscle strain, muscle weakness, and constant use of screen which is causing the problem, you'll know how to deal with it also. Whereas if a dryness is happening because of the tear film disturbance, you have to use artificial tear supplements. If there is any inflammation of the glands on the eyelids called memitis, you have to treat that also. If there's any drugs and all which are being used which may be causing dryness, you may have to try to eliminate those drugs. No? But that's a totally different condition altogether. Mostly this is the thing. Another important point which I would like to bring out here, and which is, we may not really like to hear that, is the hair color. I find that most people above a certain age group are using hair color nowadays. In my experience, it's not documented in the literature. In my personal experience, I've seen that hair color is associated with a lot of problems in the eye. Simplest would be constant soreness, redness, irritation, dryness. Slightly more, it would be inflammation, uveitis in the eye. It can cause glaucoma in the eye. It can cause cataract in the eye. And we don't really realize why, because we've been using them for years together. You know, we will say, okay, fine, I've been using this for the last 10 years. I've not changed my brand. It's the same brand. Why should it be allergic? No, it's not allergy. It is the toxic effect. And one may think, why does it happen? It should happen only. People often say, we were very, very careful. We go to the parlor and then they do it for us, you know, with their gloves on, and our eyes are all completely covered. No, the chemical is there in the hair. You know, it is either shedding into the air constantly for the next few weeks to come, or it's getting into the skin also. How it is working, how it's reaching the eye, how it's affecting the eye, I can't really give you scientific explanation at the moment, but it does cause that. So be careful. What you can do is you can do a trial. That once, if you're having the symptoms like this, give a long gap between your hair color application. It's a delayed once. and see how your eyes are feeling after a couple of months of not using the hair color. Then use the hair color again, and then see how you feel. If you think that you were very, very comfortable when you had not used the hair color for 3 months, and after using it, again the eyes are generally sore and not comfortable, that means is probably causing you discomfort.
Can I tell you something? If once you use stopping hair color,
Yes.
you will never go there. You will never
Do
do
it.
that.
So,
I can bet
so
you.
here we are.
Is there any harm after post surgery to not immediately, but to wash your eyes with water or
We say,
tap
we
water
say, we
or-
say for 1 month you should not splash water into the eye. Water does not cause any harm to the eye because even medicines have got water in it. But if there's any contamination, infection in the water, and if that goes into the eye, and you can never be sure of the water supply in Delhi, so you should avoid. For a month's time, it's better to avoid the water from entering into the eye. After a
in the
month,
long run.
long run it's fine. But washing your eyes too much, it does not help. Once in a day in the morning is okay, maybe twice a day.
Mineral water for washing, is that what you were saying?
If you're sure of mineral water quality. We are living in India, sir. We can never be sure of anything. No. Yeah. Last question.
These days, our children have to study a lot. They have to face the computer, mobile for a longer period of time, and they face discomfort in the eyes.
Yeah.
What to do? What's the solution for this?
Cut down on the visual strain, frequent breaks, frequent rests, regular eye exercises, enough sleep at night time, regular time meals, plenty of water consumption in the daytime, general physical fitness, physical health. So send them out to play in the park. These general measures are very, very important for the eye health also. But the eyes need rest. Eyes were
Doctor advised Patate, use Patate.
that is a medicine. That's an anti-allergic medicine. Does not help. See, our human eyes were meant to be looking at far off. We were supposed to be animals living in the jungle and living in the caves. No, we're supposed to be looking at far off, trying to spot our prey, and look at near thing only when we were eating something. The reading, the phones, the screens have come much later. Our eyes were not designed for these things. We are misusing our eyes, all of us, and unfortunately we cannot go back in time. So the only way we can deal with it is by actually training our eyes to work better. But however, even with the best of the precaution, you will still have discomfort at times, and you have to just live with it.
Also, where to shift India?
Yes, sir?
Where to shift India?
Where to shift India?
You told us that we are in India.
So we have to live in India, sir. We're born here, we have to live here, we have to die here.
So, you are telling about this mineral water.
Yeah.
So that you are not sure that that water is correct or not.
Yeah.
So where to shift India then?
Where to shift India, sir? I think India needs a lot of shifting in a lot of things. Yeah. Thank you very much for coming here on a Sunday morning and bringing the weather.
Thank you, sir.
And I thank my colleagues, Dr. Parul and Dr. Amanjot also for joining us here. Thank you.
Thank you, sir. Thank you, ma'am.
Let me ask you a question, sir.
Yes, sir.
I got my eyes test.
Yes, sir.
They said this is about 20%.
Okay.
Now at this stage,
Yeah.
they said you can, it's early stage, but if you go to for an operation right now, it will be much comfortable.